Keep you from myself. I'm gonna take you by the hand.
Hi, my name is Morgan Johnson, and I'm a sex educator and a counselor in training. And I just wanted to take a few minutes to talk about the nervous system and trauma. Because I think a lot of people misunderstand the nervous system, and it can contribute to a misattribution of experiences that come up and confusion. So, in understanding the nervous system, I think it's important that we first combat a quick myth. You always hear the words fight or flight, right? You know, like, those are the only options, you fight or flight. What we know about the nervous system, especially our autonomic nervous system, is that the picture looks a little bit more like fight, flight, or freeze. Because in some cases, you know, our bodies assess a threat. And upon assessing this threat, they say, okay, I'm tough enough to fight this, so I'm gonna mobilize and fight it, right? In some cases, we assess the threat and we're like, whoa, no way, way too strong, too big, there's no way I can fight this, so I'm gonna run, I'm gonna flee away. But there's cases, especially in situations like, you know, family sexual abuse, where, you know, say you're a child and dad is, you know, molesting you at night, you're definitely not going to be able to fight him. That's off the table. You can't run away because, you know, when we're children, our reflexes tell us, run towards your caregiver, run to who's going to protect you. Well, when you do that, that's also the same person who's hurting you. So our bodies are then left with this conundrum, and we enter a state called freeze, a freeze response, where we almost click out of our bodies. And we're not in our bodies while we're experiencing the dramatic things. What happens neurobiologically when we kind of click out and we're not in our bodies is that when our bodies get very aroused and our heartbeat gets over 120 beats per minute, our hippocampus, which is this part of our brain that's involved in memory and emotional processing, but mostly think hippocampus, memory, it gets turned off. So when we get really like in that traumatic state, our hippocampus gets shut off. And so normally when we're experiencing life day to day in a very calm, relaxed state, we're filing away memories, almost like a neat little filing system. Oh, just put that here, put that here. But in a state where we're being traumatized, when the hippocampus is shut off, it's more like, oh, just toss that back here. Just throw all that back here. Ah, not online, not here. And so you end up having, you know, symptoms like associated with PTSD, for instance. You have flashbacks, you have recurring invasive imagery and, you know, feelings and things that are coming back at you when you get triggered emotionally. And it's because we have all of this stuff deep in our subcortical, kind of like lizardy parts of our brain that didn't get processed or filed away appropriately because the hippocampus was offline. So the task of a trauma therapist is to very gently hold clients and allow them to explore and kind of dig up all the pieces in the deep subcortical parts of their brain that didn't get processed or filed away appropriately during the trauma or the stressful event, kind of just get them all out and then put them in a cohesive narrative so that you can tell a meaningful story out of it, because our brains can handle that way better than just lack of meaning and not knowing, and that's where the stress comes from. So to take it a step further, I want to talk about our sympathetic and parasympathetic nervous systems. So these are both part of the autonomic nervous system, and they're related to these ideas of fight, flight, and freeze. So our body has kind of an accelerator or gas pedal, kind of like a car, and we call that the sympathetic nervous system. So, you know, when a threat presents itself, you're activated to that threat, and your body is like, okay, fight or flight. That's your sympathetic nervous system kicking in. And things that happen when our sympathetic nervous system kick in are we lose peripheral vision a little bit because we need to be focused on the threat or the danger ahead. Our blood gets rerouted to the big muscle groups in our bodies, like our quads and our biceps, so we can fight. That's why, if you've ever heard of someone pee themselves because they got scared, it's the body is just saying, I don't need to be holding certain organs and parts together because that's wasting energy right now when my life is at danger and I'm imminent danger, risk of losing my life. So body lets go of sphincter or bladder so that it can reroute all the energy to the muscles and things it needs to fight. And the other thing is the hippocampus clicks offline like we just talked about. Now, in order to bring our bodies back down from that activated fight, flight state, our bodies have another system which is like the brakes. And that's the parasympathetic nervous system. So sympathetic gas, parasympathetic brakes. The parasympathetic system comes online and brings everything back down. So it re-tightens the muscles that were let loose. It helps your heart rate come back down. It brings your vision back fully. You're able to process things better. Just brings you back down. A lot of places where trauma comes up as a persistent, pervasive problem, aside from when people just, feel stigma and don't go get help or counseling, is that people who have experienced trauma or intense stresses can get re-triggered. Say you were in an automobile accident and you're driving with someone in the passenger seat right by the intersection where a car hit your car and made the car flip. Perhaps while you're just driving in the car, not even driving, but being a passenger, you might suddenly feel a sense of dizziness or flipping, and that's the body remembering that traumatic experience. And so if you're experiencing symptoms like that, then you possibly haven't processed, parts of your trauma, and going to a trauma therapist, someone who specializes in somatic experiencing perhaps, or even EMDR, only if you've done extensive therapy before, in my opinion. But, trauma therapists in general can do those tasks of safely helping you bring out and process all of the bits of experience that were not properly labeled and stored in your brain and body because of the trauma that was happening. I'm going to read you a pretty lengthy list of symptoms that Peter Levine recognizes that are all associated with trauma and could be signs that maybe that's something you want to explore a little bit further. Early feelings that can show up can be feelings of helplessness, immobility, or freezing. Other symptoms that begin to show up at the same time or shortly after those include hypervigilance, or being on guard all the time, intrusive imagery or flashbacks, extreme sensitivity to light and sound, hyperactivity, exaggerated emotional and startle responses, nightmares and night terrors, abrupt mood swings, rage reactions or temper tantrums, frequent anger, crying, those types of things, shame or lack of self-worth, reduced ability to deal with stress, easily and frequently stressed out, difficulty sleeping. Several of these symptoms can show up later, even years later after the trauma. Remember, this list isn't for diagnostic purposes, just to be clear. It's just a guide to help you get a feel for how trauma symptoms behave and show up. The next symptoms that tend to appear are panic attacks, anxiety and phobias, mental blankness or feeling spaced out, avoidance behavior, so maybe avoiding places, activities, moments, memories, people, attraction to dangerous situations, addictive behaviors like with smoking, drinking, overeating, sex, exaggerated or diminished sexual activity, amnesia and forgetfulness, inability to love, nurture, or bond with other individuals, fear of dying or having a shortened life, self-mutilation, severe abuse, self-inflicting cutting, etc., loss of sustaining beliefs, so religious, spiritual, interpersonal. And the final group of symptoms are those that generally take longer to develop. In most cases, they may have been preceded by some of their earlier symptoms. However, there's no fixed rule that dictates when and if a symptom is going to appear. This group includes excessive shyness, diminished emotional responses, inability to make commitments, chronic fatigue or very low physical energy, immune system problems and certain endocrine problems such as thyroid malfunction and environment sensitivities, psychosomatic illnesses, particularly headaches, migraines, and neck and back problems, chronic pain, fibromyalgia, asthma, skin disorders, eczema, digestive problems, spastic colon, severe premenstrual syndrome, depression and feelings of impending doom, feelings of detachment, alienation and isolation, living dead feelings, and a reduced ability to formulate plans. The symptoms of trauma can be stable, that is, ever present. They can also be unstable, meaning that they can come and go and be triggered by stress. Or they can remain hidden for decades and suddenly surface. Usually symptoms don't occur individually, but come in groups. They often grow increasingly complex over time, becoming less and less connected with the original traumatic experience. There's one more symptom that we need to look at before looking at how trauma actually gets into the body and mind and causes long-term problems. This one's a little less straightforward than the others. Here's one of the more unusual and problem-creating symptoms that can develop from unresolved trauma: the compulsion to repeat the actions that caused the problem in the first place. We're inextricably drawn to the situations that replicate the original trauma in both obvious and less obvious ways. The prostitute or stripper with a history of childhood sexual abuse is a common example. We may find ourselves re-experiencing the effects of trauma either through physical symptoms or through full-blown interaction with the external environment. Reenactments may be played out in intimate relationships, work situations, repetitive accidents or mishaps, or in other seemingly random events. They may also appear in the form of bodily symptoms or psychosomatic diseases. Children who have had a traumatic experience will often repeatedly recreate it in their play. As adults, we're often compelled to reenact our early traumas in our daily lives. This mechanism is similar regardless of the individual's age. The body of literature on traumatic stress right now is fortunately just vast and ever-growing. People are really starting to understand the relationship between our minds and our bodies and our brains, and ways to really help cope with traumatic stress, whether it was acute, like a car accident or a burglary, or, ongoing, like domestic abuse, or being a war hero or veteran. I'm pleased to hear how frequently words like PTSD come up in mainstream media. I think that people are more than just a mind-body, like the dualistic perspective kind of used to purport. And the new model we have of interpersonal neurobiology, we can thank Dr. Dan Siegel for. He sees humans as kind of a triangle, where a mind, a brain/body, and relationships, because humans are wired for interpersonal experience. We can't really conceive of ourselves outside of an interpersonal context. And our body is also part and parcel of our brain. That's to say, we have brain, like literal neural tissue called viscera around our hollow organs, around our guts, around our heart. So when you have a gut feeling or a heartfelt sense of things, that's not just a metaphor, that's very literal. We have brain tissue around those parts. It's very connected. So it's smart to see humans as a brain and body, because we have brain all through our body, mind and relationships, because we can use our mind to control our brain activity. We can train it with meditation and mindfulness. We can use our relationships to impact our mind and our brain. We can use our brain to impact our mind. It's a lovely triangle. But I think Americans are more willing now to start. I think Americans are more willing to start paying attention to their mental health and realizing that physical health is mental health. It's the same thing. It's all together. It's one holistic system. And you can't ignore your physical body and hope that your mind's going to be fine, and you can't ignore your mind and your brain and hope that your physical body's going to be fine. Same as you can't ignore, taking care of yourself and hope that your relationships are going to be fine. You have to put attention into all of these pieces. I think one of the keys to coping with trauma effectively is to just really practice having a non-judgmental, gaining a non-judgmental awareness of your triggers. So a lot of times people that have experienced trauma, when they get emotionally activated or even like physiologically activated, the danger or something, they might experience trauma symptoms, invasive, recurring images popping back in, anxiety, panic attacks, things like that. And it can feel really crazy if you're having those types of symptoms and you haven't made associations between those bodily felt sensations and what's triggering you. I've read case studies where a woman who was raped, the rapist was wearing a particular cologne, and she'd just be walking around and would smell that cologne, which was pretty popular, and have a panic attack but not realize why this was happening and just thought she was crazy. And then, with the help of her trauma therapist, realized what was going on and was able to unpack that trigger and realize, moving forward, like in the moment when she's like out at a bar or something and that happens, instead of just panic, everything's wrong, I'm gonna die, everything's going wrong, she had learned how to practice saying like, oh, okay, I noticed that I'm currently smelling Aqua di Gio or whatever cologne, and my body is being triggered, and to talk herself down from that experience, saying like, I know that in a few moments, like my nervous system will come back to baseline and I will no longer be feeling this way, even though right now I feel very panicked, So learning to, so it can almost be a matter of finding courage to really turn towards and look at and unpack the traumatic experiences that we went through, in a therapeutic context, because you can re-traumatize yourself. But the more we understand and know what we experienced, the less that our body has to cling on to, and we can begin to create narratives and make meaning from the experiences that happened to us. If you've ever read Viktor Frankl, it might have been in a psychology class or philosophy class in college. He wrote an incredible book called Man's Search for Meaning. And he was in a concentration camp, as a very educated psychologist, and observed who was surviving and who was not able to thrive and survive. And the people that were able to hold on and make it were the ones that had a little scrap of meaning. Maybe they had a novel they were going to write, or they just knew they might be able to reunite with their son. When we can transform our suffering by finding meaning, it's way easier for us to cope. And so I think a lot of times that's why the mindfulness piece, people read John Kabat-Zinn or Thich Nhat Hanh or, even Deepak Chopra, all of this, mindfulness, meditation, loving kindness, all of this stuff really, 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 really helps us cope with trauma and with suffering, and helps us find meaning and really kind of love for yourself, which just gradually unfurls into love and understanding for other people. So I would recommend anyone experiencing symptoms related to trauma and stress, in yourself or others, to read some authors who've written about trauma and neurobiology and all that great stuff. But also check out some mindfulness stuff. There's some great Buddhist authors who write about mindfulness and neurobiology. I would definitely recommend John Kabat-Zinn again. There he's just got so much information and really practical, sensible ways that you can start using meditation and mindfulness in your life to find peace and let go of trauma. Because healing trauma is really about letting our body's natural trauma cycle complete. Our society teaches us that we're not supposed to cry, we're not supposed to, scream or do wild things with our bodies, Even little kids, when they fidget, we tell them sit still. You see little sad kids twist like this, But that's the body's natural way of, almost like a centrifuge, bring energy back into the center. So the ways that we restrict our bodies and our emotions kind of make our culture really traumatizing. Like, everyone in American culture is traumatized because of not being able or being told that emoting is something that you're not supposed to do, or there's certain contexts in which you're supposed to do it. And so, you see all types of other living organisms that don't experience trauma, and it's because they let their bodies, or they don't have a culture, that has English language with sorts of stereotypes and things prescribed for how one's supposed to behave, When dogs get scared or experience something intense and stressful, they shake it off. Same thing with horses. You literally hear the, it's the body's way of letting that cycle complete and energy from the system disperse. But, if you have and this happens to people with physical trauma all the time, an EMS person might arrive on the scene and say, don't move, don't do anything. And sometimes the body really needs to be allowed to move a bit and do what it needs to do to cope with the trauma. Sometimes the eyes just need to be allowed to look around the room and observe that there's no more physical threats. And so the parasympathetic nervous system knows it's okay to go ahead and come online and start bringing the body back and bringing the mind back into the body. I think another aspect of trauma that isn't always focused on is when your partner has dealt with a trauma. Especially if it was a sexual trauma, there can be intense feelings of rejection if you're a partner who has someone in their lives who experienced rape or something. If you don't understand the nervous system, them pushing back or getting caught off guard and scared or emotional, it might feel rejecting of you, but it's really just their body remembering their trauma. And so I think the more we know about our nervous systems, we can take things less personally when we're, interacting with others who have dealt with trauma and traumatic stress. One final thing in discussing trauma and traumatic stress, I just can't emphasize enough, be patient with yourself or your partner. Your body kept you alive. Our bodies are so wise. We have everything that we need to thrive and flourish and survive packed in us as soon as we come into this world. So trust your body a little more and try and be a bit more gentle with it when you're communicating with your body. A lot of symptoms are just your body trying to send you a message. So many times, because of how we're brought up in Western culture, we look at symptoms as something that we just need to fix and neutralize. Pain is bad, let's just take a painkiller and get rid of it. But it really is sometimes your body trying to communicate an important message to you. Maybe there's a pain in your tooth because there's a little piece of wood or toothpick or something stuck in there, and it needs to communicate to you that you gotta remove it. If there wasn't pain, it wouldn't have any way to tell you that, and you might end up with a crazy infection and then lose your teeth, or who knows. So I think try to be gentle with yourself and tender with yourself and not be too harsh on yourself or judgmental. When you experience panic or, invasive symptoms, see it more as your body trying to work out what happened to you and, find meaning and complete the trauma cycle so that it can move on and move forward and not see every situation as just another time where that, trauma is going to repeat itself. It takes a long time, so just be patient with yourself and let people help you. That's the other thing, our culture teaches us that we need to be independent and strong, and the simple fact is that our brains actually have more activity when we're around other brains. They work better when we're processing things with other people. So I know that stigma and shame and fear and sadness and all of these things can make us not want to share aspects of the stresses and traumas that we've gone through in life, but doing so can help you stop suffering in response to those things. And, you can really learn to experience your body, maybe not exactly the same way that you did before your trauma, but in a way that feels safe and happy and meaningful. Trauma is not a life sentence of suffering. You can really heal yourself. And as humans, we have everything already inside of us necessary to heal. A therapist or counselor, psychotherapist or psychiatrist's job should really be just to help you realize the tools you already have to heal yourself and help you find out what contexts are best to put yourself in for those tools to work. So I just want to give you a few additional authors to read if you want to know more about traumatic stress, whether it's acute or ongoing and pervasive. One of my favorite authors who writes about trauma is Babette Rothschild. Her book, The Body Remembers, is a great launching point for anyone who wants to know more about how the body experiences trauma. She writes in a really easy to understand way and is just very gentle and knowledgeable, and I think that's a great launching point. Peter Levine is another one of my favorite authors who writes about trauma and the nervous system. He contributes so much information and knowledge and wisdom to the field of somatic experiencing. I would recommend Peter Levine's book, Waking the Tiger, and also Peter Levine and Maggie Klein teamed up and wrote an amazing book called Trauma Through the Child's Eyes. And if you experienced trauma, pervasive childhood trauma, or you have a child, or you know someone with a child, this is a really excellent book to get a phenomenal understanding of how trauma plays out in the child's body and the adolescent's body, because it's a little different than how it plays out in adults' bodies. Bessel van der Kolk is also an incredible author who I would recommend if you'd like to deepen your understanding about trauma and traumatic stress. His book, The Body Keeps Score, is amazing, and it comes with a really useful workbook that you can get on Amazon that comes with it. So I would highly recommend The Body Keeps Score, Brain, Mind, and Body in the Healing of Trauma. So if you're very sciencey and love a little bit more challenging reading and can't get enough neuroscience, the kind of deeper next level theorist and author who I would recommend for you is Stephen Porges, and he writes a book called The Polyvagal Theory, which more deeply explains the freeze response and how our vagus nerve plays into the difference between how our body reacts when we're fight, flight activated and when we're freeze response activated. And it is just incredible. If you know anyone that struggles with dissociation or, clicking out of their body, not being able to experience that, and they want a really, really deep understanding of the biological circuits at play there, Polyvagal Theory. Great book for clinicians, too. And finally, I just wanted to recommend this book with Laura Van Dernoot Lipsky and Connie Burke. It's called Trauma Stewardship, an everyday guide for caring for self while caring for others. And I think it's not only great for new clinicians or trauma therapists or anyone, volunteering at the Women's Haven. I think it's crucial to know that it's more helpful to other people receiving help from you if you have already taken care of yourself and you are balanced and healthy and strong. Because if you don't take care of yourself, you just don't have the resources to offer someone the best care and love and support or whatever they need. So, even Thich Nhat Hanh is quoted on the cover of this book saying, reading this book is like looking into a mirror. It's just really helps you have empathy for yourself and for others, and I just can't recommend trauma stewardship enough for anyone learning about trauma and working in contexts related to trauma or traumatic stress.